My students call me Brenna, so they are very close to becoming nurses.
Okay.
They're going to be my colleagues soon. They call me Brenna, but some go with Dr. Quinn, Professor, so whatever you're comfortable with is good.
I like Dr. Quinn.
Okay.
Well, I like Dr. Quinn. Let's say Dr. Quinn. That
All right.
gives us a little cachet.
Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Welcome back, you guys. Thank you very much for joining me. My name is Swadik Mayanja, and we are on another episode of the Everyday Hero Show, where I bring to you someone in your life or someone in my life that brings us good things, does good things for the community, but does not get the credit that they deserve. This week, we got a nursing professor. She is a nurse as well. You just got engaged. I mean, good things are happening to Nurse Brenna. Welcome to the show. Thank you so very much. Professor Quinn, Nurse Brenna, what would you like me?
My students call me Brenna, so they are very close to becoming nurses. They're
Okay.
going to be my colleagues soon. They call me Brenna, but some go with Dr. Quinn, Professor, so whatever you're comfortable with is good.
I like Dr. Quinn.
Okay.
Well, I like Dr. Quinn. Let's say Dr. Quinn. That
All right.
gives us a little cachet. So, Dr. Quinn, talk to me. So I want the real quick origin story. Where are you from? Where were you born? And why nursing?
So I'm originally from here in Lowell. I did go to school in Lexington. My family moved there when I was young, and then I moved back to this area a few years ago in prep for hopefully working here. I went to graduate school at UMass Boston. I did my master's and PhD there, but I actually did my undergrad here at Lowell, and it was experiences I had with professors that really got my eyes open to, like, I'd like to be that person for somebody else. I'd like to, instruct others and share nursing with them.
So that's really good. So I said quick, and she really did do it quick. So good for you. But I want to know, like, what caused you to decide nursing? Were you born and did you
decide
know
nursing.
nursing was the profession you were going to do? Did you know teaching nursing? Like, why nursing? Why
Okay,
nursing?
so going way back. So no, I didn't really know of nursing until I was about finishing high school. So my parents actually didn't go to college, so I never saw myself going to college.
You're the first one?
Yeah.
Do you have any older siblings?
I have a younger brother. He's in college now. He goes to Georgetown University. He studies political economy.
What's his name?
Zach.
Zach, good. Georgetown. Holy shit. Good
Yep,
for you,
yep.
Zach. That's amazing. But you were the first in your family to graduate college.
Yeah. So when I was in high
Congrats.
school, I saw, we live in a house. My parents seem pretty successful. And then my mom finally told me that, it's really a struggle these days to not have a college degree, that my parents were very lucky to have the opportunities they did without a college education. So then I started thinking, and I went to this thing called the National Youth Leadership Forum. My guidance counselor suggested it for me, and it's kind of like career exploration. And I went to the one focused on nursing. So we got a bunch of like tours of area hospitals and colleges, and I thought, yeah, I could do this. So yeah, that's how I
That's how it happened.
That's how it happened.
That's good. That's good.
Saw myself doing
When
it.
you were on that tour, that trip or like exploration, whatever, was there a number two, a close second? Was there anything else? Like, was teaching always part of the nursing plan, or was it nursing and then teaching?
No, teaching wasn't always part of the nursing plan. It was like nursing. At the time, going way back now, 15 years, I was interested in like business, and I've always liked nails and fashion and hair and
You've
things
liked
like
nails,
that.
fashion, and hair?
Yeah.
And you decided nursing?
Yep.
Oh, wow. We'll talk about that in a little bit. Okay. All right. Okay. Wow. Okay. All right. Good. So she's a professor, right? So she teaches nursing students. So this is probably going to be focused a lot on the nursing student, nursing school aspect of your
Excellent.
job in life, right? So I first want to know, what exactly do you teach? What year in the nursing process do you teach? Do you do any prerequisites? Where do you fit in the nursing school process here at UMass Lowell?
So our school doesn't have prerequisites. However, I teach pharmacology, which is currently to junior level students. Next year, we are moving that to the sophomore year, so starting a little earlier.
Whoa.
Getting it out of the way. And then I teach something called Community Health Project, and this is a senior level course where students treat a whole town as their patient. So they use publicly available data as well as key informant interviews and a windshield survey of the town to find health problems, and then we go address those health problems through education. So, for example, we've had students go to senior centers and do stress reduction yoga. We've had them go to elementary schools and do healthy snacks that the kids could make without an oven, without a microwave. We've gone to a home for young mothers who do not have a home of their own to talk about making their own baby food, so saving money and being healthy. So a range of topics, and the students have a lot of fun doing it.
Oh, I love that. I absolutely love that. But let's start from the beginning, right? Let's talk about pharmacology because
Oh boy, pharmacology.
Yeah,
everyone's favorite.
Favorite.
Everyone's not favorite.
Exactly. I know, because pharmacology is probably the most stressful class I hear the majority of students talk about.
Absolutely.
Right? So just why don't you tell me why you think pharmacology is the hardest, and then I can, because I'm not a teacher, so I'll speak to the student's perspective. But you were also a nursing student, so
exactly.
speak to pharmacology, please.
So even just coming in here, when I was interviewing for my job here, they said, what would you like to teach? And being a pediatric nurse, I said, oh, I'd love to do pediatrics. And being a researcher, I said, how about research? And then I got here and they're like, okay, you're hired. Here's pharmacology. So I was like, great. So I think that it's hard for students. The same reasons why it's hard for me to teach is that we only have 14 weeks, one semester, to do head to toe all the drugs that they might need to know for the NCLEX. So for me, every semester, it's a new challenge to find what can I boil down, what can I cut out to just give them the essentials to be successful on their exams and pass that NCLEX. Because I know as a nurse, as you know, there's probably like 10 drugs that we really, really super know and give all the time. And the other ones, we'd have to just review or look at a drug book. So in practice, it's easier to be competent and skilled in those 10 drugs. But to get ready for the NCLEX, we have to at least, hit the big ones and, figure out where to focus most of our efforts.
That's such a good point. I love that you said that, because I think that is the challenge for nursing professors, because the 10 drugs I need working on a cardiac floor that I need to know like down pat are very different than the 10 drugs a pediatric nurse is going to need versus an L&D nurse versus a chemo nurse. So you guys as the pharmacology professors really have a difficult job to do, right? And I think that I feel like for nursing students out there, I know we have we have friction with the nursing professors, but you have to understand that they are teaching all of the nurses in the class that are going to go to 10, 15, 100 different nursing professions, and they are responsible for making sure you all are prepared for the professions you decide to choose. I want to know why you guys decided to go from junior year to sophomore year, first of all, and then what are the things that you are doing in a pharmacology class to help nursing students get a better grasp of the hundreds of meds that they need to learn in nursing school?
So I'll start with the first question, why we're moving it. So
Yes.
I can only speak to my school, which is UMass Lowell. I'm not sure where other schools have it in their placement, how they decide to place their curriculum, but our students, they really wanted an introduction to nursing sooner. So we looked at all the courses we had and said, okay, what can we move? What makes sense? And so right now, my students, when I have them in their junior year in the fall, they are taking gerontology, nursing, and psych at the same time.
Okay.
So they're getting their introduction to pharmacology and meds at the same time that they're expected to go give meds in gerontology. So we wanted to move it before the clinicals start. So that way they at least have the foundations of pharmacology and some knowledge of meds before they're handling them. So for those two reasons, student, requesting nursing a little earlier and getting them ready to go out to clinical before they actually step on the floor. So my students this semester, they stepped on the floor before they even came to my class, just the way that the week had worked out, the first week of school. And then your second question was, how do we keep it manageable?
What are you doing to help these students remember, memorize, understand, learn the hundreds of drugs that they need to? How do you go about teaching these students those drugs?
So in my class, I take a concept-based approach. So I'm not having them memorize every single, say, stimulant that's out there. We look at stimulants as a whole class. We talk about some key names that they'd have to know and recognize, maybe like, are there some name tricks? Like for beta blockers, we know those end in LOL.
Yes.
And then we look at it as a category. So we look at the nursing considerations. What does a nurse need to know? What labs are we watching? Patient teaching. What does the patient need to know? What are some key side effects to look for? So we look at some big categories within each med class instead of like getting into the nitty gritty. So we have our first exam coming up on our chapters in a couple weeks. And on that one, students always come back to the office and say like, oh, I overstudied for it. They looked way too much into the drug chemistry, too much into the scientific mechanism of action, but just letting them know that as a nurse, there's other things we need to focus on that aren't that. So just kind of making them have their most efficient study habits through that concept-based approach.
Are you guys new? So is this concept-based approach new for you, or have you always done it since you began teaching?
I probably started this in my second year of teaching. So when I first taught the course here, when I started, I followed just what the person before me did, which was great. But then I kind of found, there's some, little tricks I can get in here and ways to make it more efficient. So for 4 years now, I've been doing this concept-based thing. But if you were to say Google concept-based education in nursing, there's whole curriculums that are concept-based. So just in the pharmacology, I'm doing it like on a small scale.
On a small scale. And is that just the plain old reason? Like, is that the why? Because you think it's more efficient?
Absolutely, yeah. I think that we have to, whether it's in school and practice, we have to increase efficiencies because we're being asked to do more and more with the same amount of resources. So,
okay, so do you think, and I've always wanted this because the questions and the stuff that I did in my NCLEX, and it's not so much the actual NCLEX, it's more of like nursing education as a whole. It was very stressful. It was very intense. It was super hardcore. And I feel like a lot of it, I don't want to say is unnecessary, but is unnecessary.
It ended up not mattering to your career.
Yes.
Right. So just remember the NCLEX is a generalist exam. It's preparing you to go into any kind of nursing except for perioperative, which was removed from the NCLEX several years ago. So you really have to have, a wide breadth of knowledge, not necessarily the depth. So you have to know a lot of stuff, but not detail about a lot of stuff.
And do you think that's the right way to go about it? Do you think it's the best way to go about it?
I think it's the best way to keep your career options open. Like, let's say the NCLEX changed to, instead of having an NCLEX general, they had an NCLEX, you want to work in PD, and NCLEX, you want to work in med-surg. So now we have specialty certifications for those types of nurses as well as others. But if you were to say graduate nursing school with a PD focus and take an NCLEX only for PD, what if you couldn't find a PD job? Or what if you decided you want to change your mind? So keeping it general keeps it open. And makes sure that, we're testing basic competence as a nurse generalist.
Okay, so let's flip the script on this. I want to know, for you as a nursing student, right? Were you straight A's getting by? Was it easy for you? And did you get by? And what did you struggle with or love as a nursing student that you bring to your nursing classes every day?
So I certainly got by and graduated and all that, but I wouldn't say it was easy at all. It was a lot of work. As we went on in nursing school, I found it wasn't necessarily hard, but a lot of work. So at first with the anatomy, the chemistries, all of the science courses, that was hard. It was hard to, wrap my head around and learn. And then as we went on the nursing, it felt more intuitive. I was also working as an aide all through college. So that was helpful, but it was a lot.
Full time?
No, sometimes it depended on the week. So I worked at 3 different hospitals because I was per diem and I did want enough hours. Most of the time I would do like 16, maybe 24. And then depending on what else was going on, I'd either drop or pick up. But those experiences were definitely helpful just to get to know, what nursing practices and styles I could pick up from others and just seeing stuff, being able to apply it in class. But so that was hard to balance it. And then as we went on again, like I said, it wasn't hard, but it was just a lot of work. Like med-surg nursing, I didn't find it necessarily hard as much as it was just so much, in the 14 weeks. I'm sorry, what was the other part of your question?
No, the other part of the question is, what do you bring? Like, when you were a student, what did you love, hate, and how did you bring that or not bring it into your class as a professor?
I'd say something that I didn't like was there's always an us versus them mentality. So students versus professors.
Dr. Quinn, she knows she's speaking to us students. Yes. Yeah. Okay. Go ahead.
Yeah. And I at times felt that too. And now even as a faculty member, I feel it, but I wish we all knew that we're here for the same reason. So nurse educators, we have a duty to protect the public and prepare nurses to be successful and safe. And nursing students have a duty to, give all their efforts and prepare to be safe, competent providers. So we're on the same team. And nursing faculty, we actually take quite a pay cut, and it's a totally different lifestyle than being a nurse. Like as a nurse, I could work, 3 12-hour shifts and have the rest of the week myself, but it's not quite that way as a faculty member.
Oh, no, it's not.
There's a trade-off. So, I can sometimes work from home and there's flexibility, and I'm not, getting up in the middle of the night to go to work. But
and you don't work weekends.
What's that?
You don't work weekends.
I personally work weekends, but some professors like you wouldn't have to.
Yes.
So this us versus them thing, it's, there's sacrifices on both sides. Something else is just an understanding of what students go through in the modern day. Our students face a lot of challenges. And, when I was in school, students face challenges too. It's not just that, we're young and figuring things out. But some of my students, they're supporting their family financially, or they're supporting, aging grandparents, taking care of siblings, nieces, nephews, whatever it might be, working full time, just really struggling. And it's amazing that they can, still have the energy and come give us their efforts in school.
I love that you mentioned that, because nursing is one of the I don't know how to even say it, but nursing is one of those professions that a ton of people choose as a second career, as a second degree. So you're right. On top of the fact that nursing school is as difficult, is as rough, is as intense as it is, a lot of people are coming this in, and they're not 20 years old, fresh, ready to just dedicate all of their time to nursing school. No, they have a husband, kids, parents. They have things outside of nursing school that they have to take care of. So now I want to talk about so the community health class you teach, so I want to know, when students get into their senior year, right? That's when they're done all the pharmacology, they're done all the med surg. Well, not all the med surg. They probably is the last med surg class their senior year, but they're ready to graduate. They're doing the capstone and all that good stuff. What is the ultimate goal for that class? Are you like letting them go doing all the research, all of that stuff? Or is it the same thing as we're still doing clinical, we're still doing the nitty gritty, like I don't know. I just felt like my nursing school experience, my senior year, could have been a lot more than what it was. It felt like a whole lot of just going to clinical. And I want to talk to you about clinical in a little bit, but what is your goal? What is your goal when it comes to that community class?
So in that course, it's where they put it all together. So they've learned community concepts. They've learned about health outside the hospital, health in the hospital, pharmacology, issues with, paying for drugs, affording care, accessing care. And that's where we put it all together. So while they take my course, they're also doing something called preceptorship. So that's their final clinical, where they're one-to-one with a nurse in a specialty that they would like to work in someday. So they are in that clinical nitty-gritty.
Yes.
But my course, the clinical, is considered their work in the community. When students first get to the class, they're kind of like, oh, this is a joke, I don't see the point. But as they dive into the community and make connections and really see the impact of their education-based work, I think they really enjoy it.
Yeah, I know. And I like the way you put that, because a lot of those classes that I remember in nursing school, like when you talk about community health, when you talk about like all of those big out there idea concepts, a lot of people are like, yeah, teach me about the disease process. And once you become a nurse, that stuff is stuff that you like, I don't want to say you can learn it on the job, but that's the stuff that you can like Google. Like the big picture stuff is the stuff that you need like the
I know what you mean. So
yeah.
Everyone wants to be out there starting IVs, doing CPR, covered in blood. Like that's so sexy, right? Like community-based work, not sexy.
No.
However, it's important. Once you know what your patients are returning to outside the acute care environment, you have an understanding of what they're going to need to go home and be healthy, and you have an understanding of what brought them into the hospital in the first place. So those are sometimes what we call like soft skills, like communication, knowing all those things. Like those are things that take a long time to develop. As far as starting an IV, we could teach someone to do that in 20 minutes.
Exactly.
And, those aren't the skills I think as nurses we should be highlighting. And sometimes those are the skills people think of what makes a real nurse. But I think what makes a real nurse is the more of those soft skills and putting it all together and, understanding where your person's coming from, what got them here, and where they're going to.
Exactly. Yeah, soft skills. That's the word I was looking for. The soft skills are the skills that matter a lot, but it's not the skills that are highlighted. Everyone wants to do
right, and they're not necessarily highlighted in school either.
Exactly.
Depending on the course.
Exactly. All right, so let's talk about your research. All right, so okay. I did a little bit of homework. So first of all, she's a nursing professor.